Good evening, greetings, and happy holidays to all. I am Dr. Langston Smith, Deputy Surgeon General for Dental Health. I'm a life member of Alpha Phi Alpha Fraternity Incorporated and a member of the Iota Upsilon Lambda Chapter, Silver Spring, Maryland. I'm an endodontist, board certified, having practiced endodontics in the Navy as a rank of captain for 30 years. I'm also a retired department chair of endodontics at Howard University College of Dentistry. It is good to be with you tonight. I will serve as your moderator tonight. Our Surgeon General, Dr. Jeffrey Sterling, is a little under the weather and has asked me to fill in for him. So on behalf of our General President, Brother Willis Lonzo III, our Board of Directors, and the Surgeon General's team, welcome to tonight's Surgeon General's Initiative webinar. Our topic tonight, 2023 Health Review and 2024 Health Forecast. The Deputy Surgeons General, whom I will introduce, will bring us up to date on their accomplishments of 2023 and what they forecast for 2024. Our panel tonight, Deputy Surgeon General for Family Health, Brother Victor Narcisse. Brother Narcisse.
Good evening. I am an internal medicine physician and geriatrician, board certified in both. I trained at the Baylor College of Medicine in Houston, Texas after graduating from Tulane University. I was initiated at Iota chapter in the spring of 1990. I'm a life member and participate in Alpha Eta Lambda chapter, and I am your Deputy Surgeon General, and I organize family health education. We speak on a regular basis on topics of interest, so if there are topics that are interest to you, please put them in the chat. We'd love to interact and try to provide education as it's brought forth. I practice in internal medicine and as a hospitalist in Houston, Texas at the Methodist Hospital. And I am the Associate Division Head of Hospital Medicine for the Houston Methodist Physician Organization. Thank you so much. While we're waiting for the others, I'd like to just talk a little bit about the kinds of things that we've been doing. We talk a lot in family health about issues that we perceive are important to the health of an individual, members of our organization, and to our community. Over the past several years, we've talked about issues of prostate cancer, of breast cancer, of colon cancer, how to provide opportunities to reduce the risk for those, how to identify them earlier so you'll have better health outcomes. We've spoken many, many times about high blood pressure, diabetes, high cholesterol, healthy lifestyle. This is one thing that's very, very important to all of us because of the risk of cardiovascular disease. We think that it's a great opportunity to educate ourselves as a community so that we can work together to improve our health outcomes. We understand that there are so many health disparities that affect the African American community disproportionately, and we'd like to continue to find productive ways of improving those.
Right, thank you, Brother Narcisse. And we're still waiting for the others to join. And so until we do that, I will kind of update you on what we're doing in dental health. So from the dental team in 2023, we produced 2 webinars. Our first one was on implants. And we titled that Implants, the Good, the Bad, and the Ugly. And what our intent was at that time was to share with you information, certifiable information on implants, because you're getting a lot of info through various means and mechanisms that was inaccurate. So we talked about dental implants as a procedure for maintaining good oral health in situations where they were needed. So we viewed situations where they are recommended, and then we identified situations where they were not recommended. Our second one was on dental pain. This was a very exciting webinar because, as you know, That's one of the problems the main problem people go see the dentist is because they're in pain. So we talked about the different types of pain and how dental pain is managed. And one of the pillars of that conversation was addressing pain that was many thought was dental pain, but in other words, it was in actuality pain from another area, different symptoms. So that's one of the things that we looked at in 2023, and so we're looking at now how do we improve patients' dental health, realizing that there is a disparity in dental health when it comes to African Americans, so that we can move that, and that's a projection that we have for 2024. I would now like to introduce Brother Ron Bailey. Brother Bailey is the Deputy Surgeon General for Mental Health. Brother Bailey.
To thank our General President, our Brother Willis Lonzer III, and our Surgeon General, our Brother Jeffrey Sterling. I'm Ron Bailey, currently the Deputy Surgeon General for Mental Health. I'm a 30-plus year practicing psychiatrist, currently in the role of chairman of the Department of Psychiatry here in New Orleans at LSU, also in a dual role of assistant dean for diversity and community engagement. I joined this wonderful fraternity in spring of '84, right at my 40th year now, anniversary, at Alpha Road Chapter in Morehouse College. And it's been a wonderful experience for me these 40 years. I'm very thankful to have the opportunity to join this really illustrious group. Speaking about health, I like the concept of the Surgeon General's initiative, for brothers, by brothers, and about brothers. The reality is the health of, I think, our membership matters. I've also had the opportunity to, like Brothers Smith and Ortiz pointed out, serve in this role for the last 2 years. We've averaged about 9 or 10 programs a year. We've hit many key themes, big issues including suicide and clinical depression, some concerns regarding psychotic illness and bipolar disorder, some concerns regarding love and relationships, as well as family conflict and stress. Huge issue for us, I think, this past year has been getting more young brothers involved. I've been remarkably pleased and excited to have had 4 programs this year where young alphas inside their first 10 years of joining, many in their third decade of life, their first decade within the fraternity, have joined and shared their own collective experience. The last had actually, we had 2 medical students at Tulane University here in New Orleans, and one young man who was a master's degree student from there who got accepted to medical school at University of Texas, Galveston. So he'll be my alumni brother going forward. I'm also a Galveston alum for next year. I think the issue of involving younger alphas is essential and important. We need to work within our fraternity, within our community, and maybe we're all within our society to really work to grow to change many of the adverse circumstances that lead to negative health habits of many persons in our society. The best way to do that probably is to not allow many adverse circumstances to be passed on, but really work to change them. Our dietary eating habits, our exercise or movement habits, our issues regarding putting our mental health first in our lives and not ignoring it until kind of late in the program or late in the game when we have other forms of health-related disparity and difficulty. Challenges that I think have historically been blocked or minimized because I think, unfortunately, the stigma against having mental illness or brain illness or being a provider of such has, I think, unfortunately seeped into our community excessively and has adversely affected the health of African American men within and without and throughout, I think, our fraternity over the course of our 117 years. We intend going forward to not let that be our future. I love the title for today's program, as part of my brother Smith. It's not just about 2023, what have we done, but 2024, really what is our future and what is our progression going to look like. And one issue for me has been taking on responsibility to ensure that every single thing that we can do, and what we know at the highest level of best practice of medicine and psychiatric healthcare for mental health is a knowledge base that we adequately and satisfactorily impart to our brothers going forward for the betterment of their health. Thanks for having me tonight. Look forward to the discussion.
Thank you, Brother Bailey. Still, Brother Carter has not joined us. But at this time, what I would like to do is that This is that time of the year. We're just a few days away from the end of 2023. It's that time of the year when we reflect on what was and what was not of the past year. And we also began to look ahead, as both Brother Narcisse and Brother Bailey had stated. In 2023, we had great news regarding the treatment for sickle cell anemia. A lot of information here recently on research results. Across the year, we were flooded with news of Ozempic and other weight loss injections. We experienced ongoing mental health crises that Brother Bailey just alluded to, and these were particularly among our youth. Then we have the endemic of violence, which happens to be the fifth leading cause of death among African American males. For some, all of these are health related items. And so we've already started this discussion, but what I would like to continue further is that each individual on the panel is, what do you have to say? Are there other issues that you would like to mention or bring forth? And what are your thoughts on those that we just talked about? Any other health related issues of 2023? The floor is open.
Yeah, I can start with we mentioned about sickle cell disease. We've seen the FDA approve several new treatments for sickle cell disease. Both of the treatments that came forth recently use essentially CRISPR technology. So for some time, we've been starting to consider using bone marrow transplantation, stem cell transplantation for patients with sickle cell. The challenge, of course, is that you need to have a genetic close match for this to work. Again, it's given mostly to young children. The new medications, the strategies that have come forth, allow the patient to become their own donor, so to speak. So that there is a genetic evaluation and adjustment done so that the patient can receive a transplantation from themselves. And these types of strategies are very, very exciting because it has the potential to open treatments to a broader number of individuals. We're still using them predominantly in children and young adults, but this is likely to change over the next several years. So look forward to a discussion on this on the family health agenda for the upcoming year.
Okay. Thank you, Brother Narcisse. Brother Bailey, any additions?
Absolutely. I think a very significant issue for psychiatry and mental health is the issue of obesity. We've struggled with this consideration for some time. There have been a variety of strategies that often patients and families have asked us in mental health and psychiatry to find ways to address, both behaviorally and with pharmacological intervention or medication management. We will always make the argument in psychiatry that behavioral strategies lead the way as being the best interventional strategies for concerns regarding obesity, exercise, proper dietary mechanisms. I myself am involved in a plant-based diet group that I think provides remarkably helpful information for men, young and old. But now there are some additional pharmacological interventions that are very popular. Our Surgeon General, Jeffrey Sterling, has some expertise in these issues that he speaks about, I think, very articulately in considerations that I've actually heard. Ozempic probably is the trade name of the most common or most popularly considered one. There's some others as well. What I'd say is there are a few things that are relevant for us. One, we don't want people to come to psychiatry and mental health with discussions about what they actually are taking to address dietary management or weight. It's not an issue, I think, to hide or be embarrassed about or shameful of. We should kind of get these issues, I think, out in the open and discuss them, I think, much more effectively and progressively. Also, all too often, are additional concerns medically that must be assessed or managed. A classic diagnosis in medical psychiatry that can adversely impact somebody's risk of having obesity, hypothyroidism, a person should be managed for such, and that should be addressed over time.
All right, thank you, thank you. I note that Brother Carter is on, so I'd like to introduce our Deputy Surgeon General for Travel and International Health, Brother Robert Carter. Brother Carter.
Thank you, Brother Dr. Smith, for the opportunity to participate today. I think we've had a very exciting year in the space of travel and international health. I would like to really report one of our accomplishments. One of the things that I thought about, as we prepare for 2023 was to look at ways that we could increase the number of viewers. And so I would like to report in 2023, we're able, within the webinars that I hosted with many brothers on the team, to exceed 100,000 views in this space. Our goal for next year, what I would like to really see, is an opportunity for us to exceed 500,000 views on the webinars that we participate in. I think there's a growing amount of interest. As a adjunct professor of emergency medicine at University of Texas Health Science Center San Antonio, and as a professor in biodefense, biosecurity at Northeastern University, as well as being a colonel, active duty colonel in the United States Army, I think there's really a convergence as we move forward, thinking about how can we better understand, first of all, how to prepare for the unknown, the unexpected. That's the space where this particular set of webinars and efforts really lie. How do we prepare for emergency response? So moving forward into 2024, leveraging our successes from 2023, I would like to really get into the space of advanced telemedicine and virtual consultation. So as we educate the public and our brothers as they travel globally, we expect, based on projections, that many individuals will get back into the frequency of travel, business travel, personal travel, that they did pre-pandemic. And that's going to require, over the last several years, travelers have basically gotten used to information on demand. And so I think what we'll begin to see is an increased utilization of advanced telemedicine, and with travelers expecting this virtual consultation. So that's one of the topics I definitely want to focus on. And what we've also seen is this increased utilization of health passports and the ability to basically take digital health records with an individual as they travel, whether it's domestically in the U.S. or traveling abroad. And then also educate and begin to continue to inform individuals about global health security and pandemic preparedness. Why is this important? There were many individuals over the course of the pandemic that found themselves stuck somewhere. Either they were traveling professionally or personally. They became ill with COVID. A member of the team became ill with COVID. And it forced them to basically have to remain in shelter in place. So I want to, in this next year, highlight the importance of global health security and how individuals navigate within different government philosophies, different policies and regulations globally. But again, I'm excited to continue to have these discussions in the international and travel medicine space. Is really an integrated portion of our Surgeon General initiative, of Alpha Phi Alpha Surgeon General initiative, because many of the topics that we talk about in this space is really a convergence of, whether that's working with Brother Narcisse, who's been phenomenally willing to help support this international space. So it's just another space that I think is a growing interest as well, and that's in wearables. I'm actually involved in a number of wearables projects, but then how can information from wearables be utilized to communicate risk, as well as provide information that can help an individual with the diagnosis as they're moving globally or even within their own communities. So I think there's a lot of opportunities actually for us to converge and continue to work together, whether that's in the psychological impacts of obesity, the international space, of travel, some of the psychological aspects. We've also gave a number of webinars this last year on stress management. Stress during this period of time and stress of traveling can be profound on individuals. So we hope just to continue to garner exciting topics so we can continue to build on our successes that we've had from a viewership in this space. Thank you, brother.
All right, thank you, Brother Kyle. Are there other comments regarding 2023, Brother Narcisse or Brother Bailey? Anything you would like to add regarding 2023 before we move on?
Yeah, I'd like to just put a point of emphasis on what Dr. Brother Bailey was speaking of. There have been a number of advancements in weight loss drug therapy. There are a number of medicines that you'll see on the market that the FDA has approved. They all fall essentially in the same classes, essentially, of medicines, but semaglutide is one of the predominant ones that we have been using more and more, and we're recognizing that under the trade names such as Ozempic, Wegovy, that these drugs seem to have a significant impact on the patients and their quality of life. And so as these medications move from investigational to accepted, then the next question is, when they have such profound benefits, are we seeing an opportunity to utilize them sufficiently? Now, these drugs are used predominantly for obesity, but they have been shown to have beneficial effects for cardiovascular health. And so as a result, we're increasingly excited for the opportunity to use medications like this. And the GLP-1 agonists are going to be something that we're all going to hear about. My own company, as part of our HR package, had a whole separate page on access to these medications, because there's a broad recognition that many individuals who have a BMI, a body mass index that's elevated, would have a benefit from this. These medications are quite costly, and to make sure that there's equitable access is going to be something that we're going to have to be watching very, very closely, particularly as the benefits for cardiovascular disease become more and more apparent. The other side of that, of course, is that as more patients take these medications, we're seeing a small number of them have adverse effects. And as a result, I've had patients come to the hospital with nausea and vomiting, with diarrhea. And these are things that generally are mild to moderate for most patients. Most get over it, but some do have more difficulty with this. And so these medications are injected drugs, not oral, in their broadest utilization. Again, the cardiovascular effects are something we're going to see a lot of. And now that we have identified this particular drug class, it would not be a surprise to me if more agent compounds are going to be studied and are going to come to market as a result of this. And I think this is going to be one of the things that we'll be talking a great deal about over the next year. The weight loss drugs. So,
Brother Bailey?
And I think that Brother Dr. Narcisse stated that very, very well. Another issue that I think we want our listeners to be mindful of really is an area that, again, Brother Narcisse is an expert in, the issue of geriatric medicine. He's a geriatrician. In psychiatry, I think we are really finally appreciating well that we can't do our job optimally. Some even challenged satisfactorily. We don't really work together across the house of medicine with other specialists. I think the reality is that that's an issue I think for members of society to be aware of and for our brothers to be aware of as well. All too often, there's been this divide between the mind and the body. I think it's artificial and probably leads to adverse or less than optimal healthcare outcomes, unless at the very inception of difficulty, we seek care that addresses, I think, both the psychological and the medical, I think, concurrently. So I think all the doctors on this sound like these issues are corrupt. But particularly speaking of geriatric medicine, all too often, problems that a person had early cardiovascular, pulmonary, and that was no longer what happened are exacerbated as they get older. But we also see in psychiatry very often with some new presentation or some issues they're not really prepared for or haven't necessarily thought historically that automatic knowledge that for older relative category with an 83-year-old mother. I think these are issues for us to be thoughtful about. Many of us generation, we're in that so-called family generation. We not only do we have kids who are now young but maybe going to school and college, but also I think persons who are in their not just fifth and sixth, but seventh and eighth and ninth decades of life. It's our responsibility to be thoughtful about.
Okay, I think I'd like to, from the dental perspective, jump in here, and that is when we look at a lot of chronic diseases, especially diabetes, cardiovascular disease, and renal disease, there's a definitely tie-in here with dental disease because of the bacterial relationship. And so as we look ahead to 2024, in this perspective, there's going to be a need for communicating more with the dental team, communicating more with the medical team to fulfill this health spectrum and the care that the healthcare spectrum rather. So as you look into 2024 from that, I would think that is something that we need to be considerate of, and that is something that we need to act on. Another thing that we need to do to facilitate all of this is communicating. And it is many of our patients don't know how to communicate with the physician. They don't know what questions, they aren't educated enough to know what questions to ask or how to respond. So as we look ahead to 2024, those are some issues that I think we perhaps need to consider. Okay. Moving to 2024 further. Speaking with our Surgeon General, Brother Sterling, looked into 2024, he says we need to look at the cause of death in Black America. At this point in time, there's data that shows the United States population, Black population, has more deaths, premature deaths, between 1999 and 2020. I think I'm reading that right. The numbers are alarming of concern gaps in health care. Are these gaps in health care? It's a disparity in health care. Okay. The top 5 causes of death in the Black males for the Office of Minority Health is heart disease, 24.1%, cancer, 19.7%, Alzheimer's disease, 7.9%, strokes, 5%, homicides, 4.5%. We're finding that in Black women, heart disease, cancer, stroke, diabetes, and Alzheimer's is high. And there are other considerations that many of these that you've already mentioned that are plaguing the Black communities at an alarming rate. Cardiovascular disease, and then under that, we have hypertension, stroke, and congestive heart failure. HIV, metabolic syndrome, colon cancer, and mental health conditions like depression, and you could add suicide to that. So these are all factors that are contributing to the cause of death in Black America. And as we look at 2024, we've already addressed some of this. I'd like to bring in now your discussions on these facts, these conditions related to what we, as part of the Surgeon General's initiative, how we will address that.
I can take the first approach. What you're seeing is a fairly fairly consistent consensus of issues that seem to be disproportionately affecting African Americans in the United States. And whether it's cardiovascular disease, HIV, metabolic syndrome, cancers, mental health, we're seeing worse outcomes in communities that are at high risk. And so we need to start to ask questions. The first question that folks have asked is that is there some genetic process to explain this? And while that there are potentially some areas of genetic increased risk, the fact that these diseases disproportionately affect African Americans over such a broad spectrum of disease really causes us to bring other concerns into play. And I think that the environment, the diet, the kinds of experiences these individuals have from the broader society are things that I think are increasingly being recognized as having a deleterious effect. Cardiovascular disease, we speak of many times on our broadcasts about diet. I'm from New Orleans. We love all the food that I love to eat. It's something that's probably poor for me to choose to eat. Exercise is not something that many of us are able to do when you're living a busy lifestyle and have family responsibilities and work responsibilities. These are things that we're going to have to continue to build into our futures as we are as we're looking for better health outcomes. So individuals have to take individual responsibility, but also there's a community responsibility, a broader question of what kind of resources and opportunities are we building for these individuals. In some areas of Houston, Texas, there are very, very few grocery stores at which you can buy fresh food. There are a number of convenience stores, but not many places where you can buy green leafy vegetables and things that put color on your plate, as we like to say, things that give you a very broad, healthy diet. So the fact that healthy food is more expensive at a time when everyone is worried about their finances, more difficult to access in certain communities. This is the type of thing where the community really has to work together to find solutions as individuals take additional responsibility for themselves. I think we see this we've spoken about this past year in maternal health, and both maternal health and infant health mortality is worse in the African American community, even when you correct for education and socioeconomic status. And so it's clear that there are experiences that are beyond just the genetics that seem to adversely affect. And increasingly, people are looking at systematic concerns that require systematic corrections. Now, whether you want to say that's racism, or whether you want to say that this is a system that provides for inequality or unequal access to good health outcomes, is a matter of semantics. But it's clear that across the board, African Americans are having worse outcomes, and we're going to have to look increasingly to system-wide, community-wide interventions to make improvements over such a broad spectrum of disease processes.
Okay, thank you. There's a question that was posed, and how long will we keep seeing homicides as a top 5 cause of death for Black men, and what can we do to address this?
Well, I'll jump in on that one, Brother Smith. I think that it's really a fair question for all of us. First and foremost, homicide like cardiovascular death and pulmonary-related problems and issues of diabetes and obesity and otherwise accidents are all issues that we think at some level we as members of society, let alone physicians, charged with the responsibility and educated, I think, to a level ostensibly of expertise in being able to intervene successfully, things that we all would like to figure are preventable, we'd be able to intervene or develop interventional strategies that are likely to be successful in working. I think that the question is tempestuous because it points out that what we're doing now is certainly not working well. And also, I think parenthetically emphasizes that we probably are not doing enough, and we certainly are not ensuring that the strategies that have been shown empirically to work in some settings, that they get to the right people in a timely fashion. So I'd say three things I think to our audience. First and foremost, homicide is a behavioral manifestation all too often of an emotional illness. Many people feel some level of emotional loss, isolation, sadness, depression, something that's taken away from their normal emotional status, or when they choose to act out bodily toward others, all too often even others who they don't know or shouldn't have a long-term prior relationship with that could have developed to some degree of acrimony and antipathy over time. I think in addition, one reason homicide is such a high risk in our society versus many others is access, I think, to weapons of destruction, whether they're mass destruction or not. There's just frankly too many guns in our society, and the guns are frankly too powerful. Many are like machine guns, and they can now fire in a rapid fire type fashion. The reality is most people who shoot don't practice. They're not a good shot, so to speak. You wouldn't bet on them to shoot a deer or some animal, at 1,000 yards, but in close proximity, shooting multiple bullets over a short period of time, the likelihood not just of hitting the target, but also causing full mortality or fatality is much, much higher. So decreasing access to what's called high capacity magazine weapons will go a long way toward limiting, if not frankly eliminating, this high risk of homicide in society. And frankly, it's unconscionable that our high-level politicians have just not had the wherewithal to do so. And I think I'll say that publicly for the record. I've written a book about this and said it in the book, so I'm on record saying that. The third thing I think we certainly have to find ways to intervene early with strategies that decrease the risk of an escalating emotional difficulty in people, mainly a young man. Homicide in our society is primarily a disease of young men against young men. Over half of the murders in our society occur by and toward and include two young men, both before their 30th birthday. So the reality, this is a young man's issue. I call it a young man's disease. And all too often, by the time it happens, a young man so inconstant has shown signs to someone at home, at school, in the community, at church, or on a team, or what have you, that they were having behavioral manifestations of illness. We were not, as a society, the whole profession of medicine and psychiatry, able to effectively intervene and get that young man off the wrong track and onto the right track emotionally and psychologically, so they find other strategies to be able to handle conflict rather than reach into violence. Those are three thoughts that I consider.
Brother Bailey, we hear a lot in the media that a lot of the homicides, especially in urban areas, are related to the sale or distribution of drugs. But what is the effect of the use of alcohol and drugs? And is that a contributing factor to this homicide rate?
Absolutely. Over half of all murders in our society include at least one or two of the individuals, the perpetrator or the victim, having a elevated blood alcohol level. So alcohol is a primary disinhibiting factor, a toxic substance most commonly involved in murder or homicide. Others can play a role as well. There are legal drugs and illegal drugs in some places that play a role, none more so than alcohol. Your point is, I think, is a timely one.
Okay, thank you very much. Brother Conner, yes, go ahead.
Yes, no, I appreciate it. Just to touch on some of the thoughts that Brother Bailey hit on, I would like to piggyback on some of those. And one of those he really touched on, and that's substance abuse. We know that definitely substance abuse impair judgment, increased likelihood of aggressive behavior. In particular, when you look at African American men of color in inner cities, this is definitely a predisposing factor to aggressive and violent acts, including homicide and other types of violent behavior. Another aspect, we have to continue to advocate as a group of African American men, as an organization, for the legal distribution of drugs of mass destruction, the fentanyls, and all the other drugs that we see entering and disproportionately affecting the African American community in the inner city. Clearly, the illegal trafficking in the country not doing enough. Many of these drugs follow the same trafficking corridors as many of the illegal weapons that are utilized to in these homicides. And so we have to really focus our attention on addressing some of the root causes that allow black men, young black men in inner cities to perpetuate violence. And again, the illegal drug trafficking and weapons are major factors that contribute to that. And I think another aspect too is we have to recognize the history of violence and trauma within our community. We know that African Americans, specifically inner cities, have a disproportionate exposure to violence at a young age, abuse, and that subsequently makes them more susceptible to engage in violent behavior, including homicide themselves. So we really have to really begin to address and again advocate as an organization for the for resources to basically address untreated mental health conditions and many of these factors that we know disproportionately predisposed. So again, um, increased access to mental health services to deal with the history of violence, address the illegal trafficking of weapons and drugs that are really putting our community at a disproportionate advantage, at a huge disadvantage for progressing and thriving in a complex society.
Thank you. And I appreciate those thoughts, especially on violence and homicides in African American males. I'd like to move on to a travel question, Brother Carter. Uh, as we travel across, since the pandemic, uh, many people now beginning to travel internationally. So, can you talk to us on the interface of travel and disease? And is there an inherent set of risks beyond just the pandemic?
Yes, brother, I appreciate those. Yes, so there's clearly a set of inherent risk associated with travel. Many of those we touched on. So when we look at some of the base disease prevalence within our population, what what you actually see is that with not just international travel, but with the stress of travel, we know that the pandemic and also travel in general has some psychological as well as basic components that involve the overall act of traveling. So when we look at the many of the risks, we are just really beginning to explore. So we're seeing now the data are rolling out for things like long COVID and some of the challenges associated with that. And even a recent study showed that even what we were not as really familiar with is some of the benefits or the impacts of any type of respiratory related illness and some of the long-term health consequences of that as well. So I think that we in 2024, that's a topic that we definitely have to really continue to hit on, and that is that interface of travel and disease, and really beginning to explore as a community what does that mean, the risk really beyond the pandemic, because I think we'll continue to see this elevated, whether it's biological risk, respiratory risk, or other factors that will continue to put our population and impacting health disparities in the future, 2024 and beyond.
Okay, thank you. There are a couple of issues that I would just like to get your thoughts on. Uh, One is HIV. and colon cancer. Those are two things that I'd like to get your thoughts on that. As we project uh, here, in 2019, African Americans represented 13% of the US population, but 40% of people with HIV. Uh, there's some thought, I read in something, I don't know how, some time ago, that the HIV may have been on the decline. But with this figure, I'm not so totally sure that that's true. Can anyone, either brother of you, address that issue?
Yes. So one of the issues is that HIV has affected the African American community disproportionately. Overall, racial ethnic minority individuals, individuals of certain gender and sexuality, individuals of lower income have typically had less robust health outcomes when they have HIV. And so we see this um, fairly consistently. And the issues are obviously very complex, and it ranges from participation in research trials, um, having equitable access, to care providers, having access to insurance access for the medications, um, uh, are some of the issues that are of particular interest here. The medication regimens have become very, very complex, and as a result, more costly at a time when uh, healthcare access, and that means having a doctor available and having the finances or insurance to pay for that healthcare, is something that is less available in the African American community. The Affordable Care Act that was signed several years ago did a lot to expand insurance coverage for many individuals on a number of drugs, but there is more work to do in that regard. Medications are still very, very expensive, and we still have individuals who don't take their medicines because they think that they can't, or they feel that they can't afford to take their medicines and pay for the other necessities in life. And so these are issues that are ongoing. We've made a lot of progress, but there's still a substantial amount of progress to make. One of the things that I'd like to bring up in regards to this topic, but I think it does fit into the broader one, is having access to culturally competent physicians. So there's a lot of data that shows that patients across the healthcare spectrum that come from African American community have had negative experiences with the healthcare system. Now, that's not all patients, and that's not all experiences, of course, but many have had these kinds of negative experiences, and many patients even have an expectation of negative experiences with the healthcare community. If you survey individuals, you can even find some individuals have anxiety about seeking healthcare, and as a result, change the way they dress or the way they speak, censor the information that they provide to their clinician because of concerns of bias response from the healthcare community. So we're trying to build a broader, more culturally competent healthcare provider group. That requires a lot of work, education for many individuals. One of the things that has been discussed is what are we doing about developing individuals that come from these communities to provide care for these communities. There's a great deal of recognition that African Americans make up more than 12% of the United States population, but really closer to 5% of the physicians in the community. And right now, only one third of those are African American men. So if you're looking for an African American man, because that's the one that you find most comfortable to share issues of great personal anxiety or concern with, you may have challenges in identifying individuals in your community. And many individuals, Dr. Bailey is one of the pioneers in this regard, have been working for a long time in trying to expand both the pipeline of individuals who are in their younger ages of training, as well as recruiting, mentoring, and supporting individuals who go through medical training. But clearly, there's more work to be done. And the numbers of African American physicians, African American male physicians, really look not that dissimilar to what they did in the 1970s. And so we're very, very concerned about that. Now, that's not the only way to provide culturally competent healthcare. Training, education, an interest, a willingness to recognize that to care for diverse populations, you have to learn about diverse populations. And so the more that we learn about each other, the more that we communicate with each other, the better we will be. And so I think that at a time when diversity is not always a popular topic across our national ecosystem, I would actually advocate that diversity in healthcare, diversity in medicine, diversity in the conversations that we have with each other is actually quite beneficial. And so I encourage people to talk to each other, but then talk to your physicians, talk to your family, ask questions of your family about their healthcare, then bring these issues to your physicians. And if you're having difficulties communicating with the physicians, share with them your concerns. Share with them very, very clearly that you're hoping to discuss things that are very, very important to you, and would love to invite your physician to have even deeper conversation with you about your health care, your health history, your health risks, and opportunities for prevention and treatment.
Okay. All right. Thank you. I'd just like to share, I appreciate your point on the demographics of the health professions when it comes to medicine, and share that you're a little bit better off than us in the dental profession, because with the 15% of African American population, we only have 2.6% of dentists and less than a third of male. So we're running into that same situation there. Okay, SB, thank you very much. And to wrap this up, I would like to ask each of you to give a tip to the audience regarding their health. And I'll start off by just saying, related to your dental health, good dental health requires good dental prevention and seeing your dentist, and that prevents a lot of issues later on. So our statement to you is take care of your teeth so they won't be false to you.
That's good.
Okay, Brother Narcisse?
Sure. I would encourage everyone to reach out and develop a relationship with a primary care provider that you feel comfortable with, and have ongoing and regular conversations about them, about your health goals and expectations and things that you can do. And one of the things I'm going to challenge each and every one of us on the broadcast, and everyone who might be listening, is to find better ways to improve your nutrition in 2024. What I have learned, and it's very, very clear, is that you can't out-exercise a bad diet. And so if you think about diet as a thing that we do in January, by February, the diet will be gone. So we need to make sustained changes to our nutritional intake, put more color on your plate, more green leafy vegetables, and all the things your grandmother told you to do, that was necessary.
Okay. Brother Bailey?
Yeah, first and foremost, I do get to go out and have dinner with Victor Narcisse, so I'll make sure that he and I follow his recommendations. They were timely, especially about the green leafy vegetables, if you will. So well stated. I'll be brief. I think that for psychiatry, especially during the end of the year, people talk about holiday blues, and I think Dr. Narcisse makes a great point, as well as Dr. Carter, I think, earlier. The issue is, how people think about what they're doing, and we should have adequate planning. Our term is expectations. All too often, we go into a new year with expectations that may be more potentially harmful than beneficial. It takes 30 days to change a habit. So you're unlikely, whether it's a dietary habit, or if you're going to stop smoking or drinking, or if you're going to start exercising, or the case may be, to be aware that you can't get it done immediately. So set an expectation or a goal that's achievable, achieve it, and then move on to another bigger one. So being incremental in our approach is probably a much better strategy for 2024 than maybe some of us have employed in prior years when we thought we failed. Avoiding failure, whether it's New Year's resolution or a change in our life, whether we're going to retire and start our own business, or whether we're going to go to frat meeting regularly and make the meeting throughout the year. We want you to be successful, and I'm going to leave you with this concept: set reasonable and attainable expectations, make them, engage to make them successful, and then incrementally move to a higher level, a greater degree, I think, of sacrifice, and find the clinical benefit that occurs over time as we have multiple small wins in our life. We think that goes a long way toward improving your emotional health, and I think decreasing the risk that some have when we stop or give up on some of our dreams. Thanks for having me tonight.
Thank you, Brother Bailey. Brother Carter.
Yes, I'll piggyback on those, on the great tips that's been shared. But from a travel international perspective, a good tip that I would like is to provide is really maintaining health during the winter months as we really prioritize the immune system support and practice healthy habits to prevent winter-related issues. So again, if you haven't been vaccinated, get your vaccinations as you engage with family members. Remember to stay hydrated, and most importantly, remember that during this period of time, be mindful of any signs and symptoms that you may be exhibiting, heart attack, stroke, and also watch out for loved ones. During this period of time is when we typically see an increase in hospital admissions or deaths related to stroke, and heart attacks. So remain vigilant, and again, maintain a good diet. And so, during this time, and most importantly, if you're going to do a lot of traveling, stay hydrated, because that's another way that you can protect yourself. But again, have a happy holiday and happy safe traveling, and remember to prioritize immune support during this period of time where we tend to see a lot of respiratory illnesses, COVID, influenza, all of the traditional respiratory illnesses are increasing during this period of time. Thank you, brother.
All right. Thank you, Brother Carter. I do have an oh, by the way tip, and that is, I would say to the audience, please pay particular attention to lumps, bumps, ulcers, and red lesions of the oral cavity. If you experience any of these and they last more than 10 days, please get them seen by a dentist. The reason I mention that is because oral cancer is very prevalent among African American men, and they usually don't realize it until it's too late. So my particular tip tonight is pay attention to lumps, bumps, red lesions, and ulcers of the oral cavity and get them checked out. I would like to thank the panelists for tonight, our Deputy Surgeons General. This has been very exciting. The discussion has been great, and I thank you very much. And I want to wish everyone a happy holiday. And as Brother Carter said, be safe and enjoy your families, friends, and festivities, and don't overdo it. Good night, all.
Good night.